is the second case, this is the good one. Okay, go, diabetes.
This is an information giving and management station of Miss Judy Smith, a 33-year-old female who has recently been diagnosed with newly diabetes type 2. Come in.
Hello.
Hi. Hello. Miss Judy, is it?
Yes. Yeah.
How are you today?
I'm feeling fine. Yeah.
Okay.
Doing well.
Okay, good to hear. So can you just confirm your full name and date of birth, please?
Sure. Yes. It's Judy Amelia Smith,
Yeah.
and I'm 33 years
All
old.
right. Okay. And how would you like me to address you?
Judy's fine.
Okay. All right. So, what brings you in here today, Judy?
Well, I've been recently told that I have something called diabetes.
Okay.
I mean, lots of people in my family have it. So,
Okay.
yeah. It was quite a shock.
Yeah.
But apparently, it can be sort of managed okay with tablets and things.
Okay.
I
Alright.
mean, I've seen lots of my family members kind of manage it okay.
All right.
But yeah, that's really why I'm here,
You're
I
here.
suppose.
Okay. All right. And so, do you know anything about diabetes, of what it is, what's going on?
Yeah, so it's to do with your blood sugars.
Okay.
And there's lots of things that, like my aunt, she's tried so many things. She's been doing like exercise and loads of different
Mhm.
stuff to try and reduce the blood sugars.
Okay.
And I'd really be interested in trying to do that.
All right. That's
Because
good to
I've
hear.
always struggled with,
Yeah.
just looking after myself but yeah, sorry.
Yeah.
Anyway,
No, don't be. Go ahead.
I don't really understand sort of what exactly is going on.
Okay. All right. Not to worry. That's why you've made an excellent choice of coming here today, and
Mhm.
I'll try to explain it bit by bit. Okay.
Yeah.
All right. So, have they told you what type of diabetes that you've got?
Yes, they told me I have type 2
Type 2.
because
Okay.
it's just come up.
Okay.
Yeah.
All right. All right. So that's a good place to start with.
Mhm.
Okay. Because type 2 can be reversible. Okay. So that is
Okay.
something to keep in mind, and it can be managed by lifestyle factors as well.
Mhm.
Not everyone will end up needing medication anyways. Okay.
Yeah.
But that, yeah. So that's we've started off from a good point. Okay. All right. So what it is that in diabetes you have high sugar levels in your body. Okay.
Mhm.
So whatever you eat, that turns into sugar. So you ate a piece of bread, that turns into sugar. Okay. And so you have these building blocks in your bodies. These are called cells, and they need that sugar and energy in order to function its best.
Yeah.
Okay. All right. With me so far?
Yeah. Yeah.
Okay, all right. But in order for that energy and that sugar to get to those building blocks,
Mhm.
you need a key to open a door, to push in those sugars to those cells
Right.
to work. Yeah? Okay. That key is insulin, and that's a chemical messenger. It's a hormone that a structure in your body called the pancreas makes. And so what's happening in type 2 is that your cells are not responding to that insulin very well. So
Mhm.
you still are making insulin, unlike type 1, which they don't have an insulin.
That's good.
Yeah, so that's fingers crossed you still do have insulin, but they're just not, the sugars aren't able to really get into the cells properly, and so your cells aren't really functioning as the best they're supposed to. Yeah?
Yeah.
Okay. So did that make sense?
Yeah.
Okay. Do you have any questions so far?
No, not really.
No. Okay, all right. Can you just repeat to me, just in briefly, what you understood from what I've said?
Yeah, so we have, so you have high glucose levels,
Yeah.
and then that's just caused by eating things, and then you have this thing called insulin
Mhm.
that I'm, like, sort of, apparently I don't have that much of it. Or,
Okay.
no, I still do have it
Yes,
because my
you do.
pancreas makes it.
Yeah.
Oh, right, it's type 1, they don't have it.
Yeah.
And then that allows glucose inside of your cells.
Yeah. Yeah. Okay.
Okay.
All right. And so there are ways for us to make that better, just simply by changing a couple of things in your lifestyle. Okay. So before I move on to that, I'm just going to take just a brief, quick, just understanding of your past. medical history and social life, okay? So do you have any other medical conditions?
I mean, I have asthma.
Okay.
I've got a couple of food allergies.
All right, okay.
Nothing else, no.
All right, okay. Are you on any medication for?
Yeah, I'm
Yeah.
taking the pill.
Okay.
And then I've got my inhalers.
Mm-hmm.
No other medication. No.
Okay, all right, okay. And you mentioned you have allergies to some foods, is that correct? Do you have any allergies to any medication?
No.
Okay, all right. And so what is that you do for a living?
Oh, I'm unemployed at the moment.
Okay, all right, okay. So do you smoke at all?
No.
No? Drink any alcohol?
Yeah, I enjoy drinking some alcohol, yeah.
Okay, all right, okay. So, okay, now moving back to try to help you out with some lifestyle factors that you can do, okay? So, one of the things is the cause of type 2 diabetes can be caused by an increase of fat production in your body, okay?
Mm-hmm.
So that can be either the person could be overweight, it could be probably the fact that increased of fat just simply by the diet of what you put in.
Mm-hmm.
Okay, so may I ask, how's your diet like?
It's not great.
Okay.
I do eat quite a lot of takeaways,
Okay.
but I've been trying to cook a bit more
That's good. Yeah.
recently. I mean, since I got diagnosed, because, I just need to sort myself out
Yeah,
and
yeah.
just start, doing things. But
Yeah.
it's quite hard to sort of change just how you're just brought up,
Yeah, I understand.
We're just
Yeah.
used to not eating
Yeah.
very well at home.
I
and-
see. Yeah. Yeah.
But I want to learn to cook so then I can cook well for my kids.
Yeah. Yeah.
But I'm not really sure where to start with all of that.
Yeah. Yeah. Well, I just have to say that you started off on an excellent point. That it's just the push and willing to change.
Mhm.
That's fantastic. And we're here to help you, obviously, with helping you progress. So there are many things that I can help you with. There are a lot of programs. There's a lot of also weight loss programs. For example, have you heard of Weight Watchers?
Yeah, I
Yeah.
was interested in the other Slimming World. I think.
Slimming World, yeah.
Yeah,
I can definitely signpost you to all of these things as well, and you can have a look.
okay.
Yeah.
Mhm.
Does that sound okay?
Yeah,
Maybe it could help
definitely.
you. Yeah.
Yeah.
All right. And what about exercising? Do you usually exercise?
I just don't enjoy exercise.
Okay.
And my aunt got on this new training program
Mhm.
where she got a gym membership,
Mhm.
and I think it really helped with her diabetes.
Okay.
And she's been telling me to do something about it now,
Yeah.
because she's already 50 in her 50s.
Yeah.
And she's got scared about some of her friends started having some problems with
I
their
see.
feet.
Yeah.
And I mean, I'm just staying away from the internet at the moment because there's just horrible photos
Yeah.
about
Yeah.
diabetes. And I mean, will all of that happen to me, or
Okay.
do we have good medication nowadays? Is that just in the past?
Nowadays, definitely there are lots of medication that have come to help. Obviously, yeah.
Yeah.
So there is a tablet that we do give, and it's called metformin. Okay, and what it does is that it stops the production of those extra sugars from being making.
Mm-hmm.
So it kind of just settles everything down and stops the spikes of the sugars from going up in your body. So that's something that can help as well.
Okay.
So in terms of speaking of medication, yeah,
Okay.
yeah. Do you have any questions around that?
Not really.
No? Okay.
Just a tablet, is it?
Yeah, it's
Yeah.
just a tablet. And the side effects would just be tummy upset, to be honest. Feeling a bit nauseous when taking it, but and some people get constipation, some people don't, so it kind of depends. But other than that, no severe harmful side effects that I'm aware of. Yeah. Does that sound okay?
Yeah.
Yeah. Do you have any other questions?
Not really. I won't have to take any injections, will I? Because somebody I know has to inject
Yeah.
themselves,
Okay.
and like I'm really scared of needles.
Injections. Okay.
Yeah.
So another thing we can hope for and be happy about
Mhm.
in type 2 is that in type 2, it's not like type 1 where you have zero insulin. No insulin's been made in the body. Therefore, you have to inject yourself with that insulin.
Right.
Yeah,
Okay.
but in type 2, injections are never the first line of management or anything. That action can just be later on, later
Mhm.
on, in whenever, if it's not managed really well from the beginning,
Okay.
you know? So I feel like if we start off in a good place and help you manage it from the beginning, then hopefully we can stay away from all those complications
Right.
and those things.
And if I sort of try and fix up my diet
Mhm.
and maybe do the exercise stuff and things as
Mhm.
well, because I was reading online, like, will it go away? Like, will it be cured or?
It can go away, yes.
Right.
Yes, it can. Yeah. So hope for the best.
Mm.
Any other questions?
No, not really.
Yeah, all right. I really don't want you leaving today feeling like you have questions and feeling like you're unsure. So if there's anything you'd like to tell me, just feel free.
No, I think you've answered everything. Yeah, thank you.
Okay, you're welcome. And I can just give you a couple of websites and leaflets just to help you out
That would be great.
understand your condition more.
And the referral to Slim
Definitely,
and
yes,
everything.
yes.
Okay, I'll
Okay.
try and work on it. But
All right. Yeah,
okay,
fantastic.
see you.
Okay, bye-bye. Have a nice day.
And cut.